Hey guys, Brenden here. And a while back I made a video talking about the many different methods that bacteria can use to evade antibiotics. And this is a massive problem, which could literally lead to somebody dying if they can't get an effective antibiotic to clear up an infection. And so in the video, I talked about a client who came to us with chronic bacterial prostatitis, who was battling this for literally a year. He's been to many different doctors, and nothing he tried worked. None of the antibiotics would clear it up. He was in constant pain, and it was destroying his relationships and his work career. And so this is his testimonial, overcoming chronic bacterial prostatitis when all hope was lost. And so in this case study, I'm going to reveal how our cutting-edge methods helped John overcome a year of pain and frustration in just 3 weeks. So John is a 42-year-old male, 82 kilograms with approximately 16% body fat. He sought our help in April of 2024, this year, after suffering from chronic bacterial prostatitis for almost a year. And as a software engineer, John's condition significantly impacted his ability to focus, work, and maintain a normal quality of life. His daily routine was severely disrupted by symptoms like burning during urination, urinary urgency, and constant pain. And he also suffered from this mental exhaustion and cognitive impairment. And it seemed like during every flare-up, he got this severe brain fog, which made him almost unfunctional. And so he faced several major challenges. First was the recurring bacterial infection, which was resistant to multiple different rounds of antibiotics. Severe urinary tract symptoms, including burning, urgency, and slow urine stream. Side effects from potent antibiotics, such as risk of tendon rupture and nerve damage, which can occur with some of the fluoroquinolones. And lack of any progress after 3 months of treatment, causing despair and loss of hope. Inability to perform at work due to the mental exhaustion stemming from persistent infection, and the extreme levels of brain fog and cognitive impairment that I mentioned during each flare-up. And so John needed a solution that could eliminate the infection for good, restore his quality of life, and minimize the risk of side effects from harsh antibiotics. So we implemented a comprehensive, scientifically backed approach to address John's chronic infection and weakened immune response. First is targeted peptide therapy. We needed this to improve his immune system, because that can help aid the body's ability in fighting an infection. And in fact, it's been shown that people who have a suppressed immune system, even with antibiotics that are targeting an infection that doesn't have antibiotic resistance, the ability for them to clear up the infection is still greatly reduced if the immune response is suppressed. And so this is a very important part of the program. And then a biofilm disruption compound. But actually, superbugs can use quorum sensing to create a coordinated assault against antibiotics through both stimulating certain gene expressions, which can render the antibiotics ineffective by basically attacking them, or creating a biofilm, which can shield them from the antibiotics so then the antibiotics can't reach them. So we use the compound designed to break through all of these defenses, allowing antibiotics to penetrate and effectively destroy the bacteria. And a precision antibiotic. After evaluating the nature of John's infection, we paired these strategies with a carefully selected antibiotic to work in synergy with the peptide and biofilm disrupting compound. And so this combination addressed the bacterial defenses while minimizing the required antibiotic dosage and duration, which is important because these antibiotics are powerful and they have side effects. So, regular monitoring and adjustments. We assessed John's progress weekly and adjusted the protocol to ensure the bacteria were being effectively eliminated while minimizing the duration of antibiotic use. And here's the results. Before our interventions, John's health and performance metrics were a 9 out of 10 on urinary pain. He had severe burning during urination. Urinary frequency was like 12 or more times per day. And he suffered from severe frustration and anxiety over the recurring infection. And he had reduced cognition as well, especially during each flare-up. And he had greatly reduced physical activity due to pain and fatigue. But after just 3 weeks of our intensive protocol, John's improvements were remarkable. His urinary pain went down to 0 out of 10. He had absolutely no pain or burning during urination at all. His urinary frequency reduced to 6 to 7 times per day, which was totally normal. His mental health significantly improved, and he felt feelings of relief and optimism. And his physical activity was fully restored. He was able to resume his regular exercise routine. And qualitatively, John reported, "I can't believe how quickly my symptoms disappeared. I went from unbearable pain to feeling completely normal within weeks. For the first time in months, I can work without constant distractions or pain. Not only is the infection gone, but I feel healthier overall and more energetic than I have in years." Here's John's review. "I had completely lost hope after months of taking harsh antibiotics with no relief. Unyielding Vigor's approach was unlike anything I'd ever tried. The combination of peptides, targeted compounds, and precision antibiotics saved my life. I've been infection-free for months, and it feels like a miracle. If you're struggling with something doctors can't fix, don't wait. This is the future of medicine." And if you want to get coaching, you can just check the link in the description. And we've actually had a couple clients come to us with this same exact problem, and we were able to help all of them. But it doesn't matter if your prostatitis is of the bacterial nature like John's, or if it's just chronic prostatitis, which is inflammation of the prostate, which can be also a result of a prior bacterial infection, which can cause some scarring and residual inflammation in the prostate, or if it's benign prostatic hyperplasia, which is another multifactorial problem, which is not just related to, your DHT levels and your androgen receptor sensitivity. It can also be related to your estradiol levels and your overall genetic predisposition. But we can address any of these problems with a comprehensive program for you. And I can confidently say that we could do a better job than anybody else because, well, we know things that other people don't know. And for example, I was the first person to make a video on the use of prostatitis for chronic prostatitis or benign prostatic hyperplasia. It's actually been shown to reduce the size of the prostate and the inflammation of the prostate. Therefore, it's more effective than traditional medications you can get from your doctor, such as alpha blockers or PDE5 inhibitors. And while these medications are great, they mainly work through relaxing the smooth muscle of the prostate and the bladder, just to relieve symptoms associated with prostatitis, such as urinary urgency, frequency, slow urine stream, and burning during urination of the non-bacterial nature. But regardless of which problem you're experiencing, we can not only diagnose you, but we can put you on a proper treatment program to get you completely cleared up from this problem so it's no longer causing you pain and misery like it was for John.